just look at this optical illusion, okay? You can see multiple things in this picture. Now, you can see those big faces there, and then there are two people who are sitting there. One is playing the music, okay? Now, you can see them all, but I want you to see the person who is playing the music and the big face together. That means simultaneously. Can your brain see that? Okay. What happens when we are looking at the picture, when you want to look at that, person playing guitar, your brain only acknowledges that. Though your brain knows that there is something like a big face which exists, brain, does not want to see that, and you see only that. So brain very quickly, changes from big face to small, that figure which is there. That is how exactly the trifocals work. That means all the images from distance as well as near are in focus. Our brain decides which one you want to look at. Okay, so we'll go to the, so this is how even the extended depth of focus technology work, but little differently because it elongates the focus. So there are, it's basically a polyfocal IOL, I would say, rather than a, just extended depth of focus. So these were the initial multifocals which came into market when even I was not in the practice. These were the refractive multifocals, and they went out of vogue initially because there was a lot of loss of energy, and that meant that there were a lot of dysphotopsia and loss of contrast. Next generation trifocals and multifocals came where they reduced this loss of energy. But again, loss of energy means loss of contrast. So you are seeing things less bright. So now the new extended depth of IOLs have come, which are going to give much less reduction of the light. So you can see in this optical bench testing, the one, for example, the Lentis M Plus, you can see how the light is, seen there. While in case of the multifocals, refractive as well as diffractive, there is diffusion of light or loss of light, which is there. So that's why you have much brighter focus of light in extended depth of focus IOLs. So this is a comparison of light loss in different IOLs. You can see that in the multifocals, either refractive or diffractive, there is much more loss of light as compared to the extended depth of focus IOLs. And as I told you, for example, this middle segment shows the extended depth of focus IOL, and it's quite comparable with the monofocal vision if you see the distance, because the contrast loss is not there. But if you see the trifocal, obviously there is contrast loss because of loss of light and aberrations which are created. You can see this is how the patient sees when a pointed light is shown to him. So you can see the upper figure where the trifocal shows, a lot of glares and halos, while the extended depth of focus, there is much less. And the lower one, it actually shows the M plus lens, EDOF lenses aberration. You can see there is only half part which has some aberration, but which are much less than the glares and halos which are seen in trifocals. So trifocals come with these complementary glares, halos, and starbursts, which are much less experienced by the patients who have EDOF. Again, example of multiple ways how the point source is seen by the patient. Even I would like to show the Symphony IOL, which is diffractive EDOF. So it's more of a diffractive multifocal with low ad rather than a EDOF. And it also shows the glares, as you can see there, and halos. But you can see the Lentis profile, it is having much less glares and halos as compared to others. Let's look at different types of EDOFs, and then the particular IOL will be discussed by the experienced surgeons. So the first one is monofocal EDOF. We commonly know IHANS and magnificent IOL that we use commonly. So this is not actually in real terms extended depth of focus. They have just played with the positive spherical aberration of the lens. And the issues with this is that when you do the bench testing with these IOLs, you cannot go above around plus 1.2 diopters of addition. That's why this enhanced depth of focus IOL, for example, IHANS gives around plus 0.6 depth of focus addition to the monofocal, because monofocals also give around 0.5 diopters of extended depth of focus, and 0.6 addition to that is given by the IHANS, while the magnificent will give around plus 1.1 additional depth of focus, which are much less even for intermediate vision, I would say. And they will also have some blurring effects. So if the patients have small pupil, then these positive spherical aberration, enhanced depth of focus IOLs will create some blurring for the patient. The second one is the diffractive EDOF. As we know that they came initially into market, Symphony and AT Lisa, Lara are the example. But again, I would consider them as more of a, the low ad multifocals rather than actually a EDOF, because they were associated with loss of light and as well as glares and halos. Then came the aberrational EDOF, which Dr. Nitin will be speaking about. It's the Minivel, the example of it. So they played with different zones, and they played with the spherical aberrations of these zones, and these aberrations provided a depth of focus. Pinhole EDOF is not yet launched in India, but launched in probably European and American markets, and it gives almost up to +3 diopters of the depth of focus. It also negates some amount of astigmatism, but it reduces the, again, light that is entering the eye, so you may be able to use it only in one eye maybe. Polyfocal EDOF, again, it has not entered yet Indian market, and again it is basically it gives very high addition in the center, and then it goes reducing in the periphery, giving very high near addition power, but again it will have its own disadvantages along with it. And then there are refractive EDOFs, where there are refractional zones inside the lens. So one zone is for the distance, another is for intermediate, and maybe for near. So these are the overall different types of EDOFs. And so after this introduction, brief introduction, I would like to ask, I think, Dr. Nitin, you will be. Okay. So I would like to request Dr. Kumar Doctor. He will be speaking about his experience with EDOF IL technology, and I'm sure he will be able to answer a lot of questions we have.